Dr. Alex Earl. We're here at Pure Plastic Surgery today, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your plastic surgery questions. You all miss me? I missed you guys. As you all know, I was out last week on vacation. We had a great family vacation down in Peru. It was really awesome, terrific. It was one of our bucket list type of trips. We saw Machu Picchu, we went sandboarding, sand skiing, hiking, horseback riding. It was a really incredible experience. But I wasn't able to do Hump Day, so we're here today. And we're back at it, and raring to go. So today I thought I'd talk about a brief topic here. We're going to talk about a topic, there you go, that we get asked about a lot. And then of course we'll be happy to delve into all your questions. Okay, so what is the main topic for today? The main topic for today is going to be fibrosis. Okay, so we get asked about fibrosis quite a bit. It's something that, a lot of times is not fully understood. Also, it's not fully understood, like why you get it, how to prevent it, how to treat it if you have it, etc. Okay, so I'm going to kind of go into all those topics so that we can get a better understanding of what fibrosis is, and most importantly, how to prevent it, because really that's the main thing right there. But then we'll talk, of course, about how to treat it if you do develop some fibrosis. Okay, so first of all, when does fibrosis happen? So it typically happens after liposuction, right? So this is something that we are concerned with after a liposuction procedure. So it can be a lipo 360 or lipo 360 with fat transfer, i.e. a BBL. Okay, so that's typically when we're talking about fibrosis. And the most common area for fibrosis is the abdominal area. So the anterior trunk or the abdominal area. Sometimes a little bit in the flanks. That's maybe spot number 2. So spot number 1 is at the anterior abdomen. Spot number 2 would be the flanks, and very rarely do you see it in the back. I've almost never seen it in the back. You can get it in some of the smaller areas like the arms and the thighs. Sometimes you can see it there. But the most common area by far is the anterior abdomen. Okay? So what are some of the risk factors of fibrosis? Well, of course, it's when you do liposuction, so lipo 360 or liposculpture is when you can have the risk factor for fibrosis. And there are some things that actually can make the chance of fibrosis occurring a little bit higher. For example, if you have either poor quality or loose skin, then that actually in and of itself increases the chances of fibrosis. Okay, so what is fibrosis? Fibrosis is basically scar tissue. When the skin does not kind of heal appropriately and it heals more like a scar, and it's typically an area that feels hardened underneath. So like you see like a little bulge or an unevenness or a lumpiness, lumpy bumpy feeling, and when you go to touch that, it feels kind of hard, which means that there's inflammation and that there's scar tissue. And that's something to differentiate from other areas that other causes might cause something to be lumpy, bumpy, or uneven. If you have some lumpy bumpiness or uneven and it's not hard scar tissue and the skin is kind of moving around, then typically that means that the issue there is skin laxity or loose skin. And so then the treatment is going to be completely different than if it actually is fibrosis. So that's why the diagnosis is so important. So the first thing you got to do is you got to feel the area. If it feels soft and squishy, but the skin is fairly tight, then that's maybe a little bit of excess fat, and therefore the solution for that is a little bit more liposuction. If it feels soft and the skin is moving around, you can kind of move the skin and move it all over the place, then the issue there is then skin laxity or loose skin, and therefore the solution might be like a tummy tuck or a skin tightening procedure. Now, if you're feeling it and it feels kind of hard and kind of stiff and not really moving around, then that's most likely fibrosis. Okay? But fibrosis has some surgeon-dependent issues or risk factors and some patient-dependent issues. Okay? So from the surgeon side, what does a surgeon have to do to try to minimize the risk of fibrosis? Well, you have to not be overly aggressive. So the more aggressive you are with the liposuction, the higher the risk of fibrosis. Okay? So, for example, if you thin out the tissue too much, if you remove too much fat, so if you leave only like a very thin layer of skin, basically over the fascia or the muscle, the risk of fibrosis is higher. So that's why when I do my liposuction or liposculpture or BBLs, I want to leave at least like a centimeter of fat underneath that skin level, okay? So that we have a lesser chance of fibrosis. In some patients, you may have to leave a little bit more. For example, there's a certain degree of skin laxity. You actually want to be less aggressive. You may leave a centimeter and a half underneath the skin there, okay? But the reason for that is that if you go all out and remove just as much fat as possible and thin it out too much, then you're going to increase that risk of fibrosis, and you don't want to do that. So, we don't see it so much today, but maybe a few years ago, we would always get patients saying something like, "Hey doc, suck me dry," basically, right? Saying like, remove all the fat. I don't want any fat on me. And that's actually not the best thing to do, because you're going to increase your risk of fibrosis and scar tissue and problems with the skin, like skin necrosis or lipo burns, okay? So you want to leave a little bit of fat underneath that skin. I would say at least a centimeter of fat underneath that skin, okay? So that's from the surgeon side. From the patient side, what increases the risk of fibrosis is being non-compliant. Basically not doing what you're supposed to do post-op to take care of yourself and take care of your skin, right? As you all know, you've heard me say, and I've held up the sign, right? That says that your post-op care is just as important as the surgery itself, all right? And I truly mean that. The surgery itself is only about 50%. The other 50% is your post-op care and being compliant with your post-op care, okay? In regards to fibrosis specifically, what's going to help prevent the fibrosis are, number one, your massages, okay? So you're going to need a minimum of 20, at least 20 post-lipo lymphatic massages done by a professional, all right? You're not going to Massage Envy here. They don't know what the hell they're doing regarding this type of massage, okay? You got to go to a professional who really knows what they're doing in terms of post-lipo lymphatic massage, okay? Jessica here, Bestie Jeannie, she's awesome at it. Of course, there's a lot of great places out there as well, but you got to go to someone who specifically does this type of massage, and you're going to need at least 20. All right, some patients may need more. It's not unusual. Sometimes you may need 25, 30, okay? But no less than 20. All right? You do less than 20, risk of fibrosis goes way up. All right? All right, next. 40. Yes. Oh, yeah, 40 massages. There you go. Sometimes you need more. Hey, you got to do what you got to do to protect that investment for the long term. Think of it that way, right? You made a huge investment in time and money, and you want to have the best results, and you want this for the long term. Okay? You can't think short term when you're talking about your post-op care. Okay? All right, next, your compression. Here, there's a few nuances which are very, very important. Number one, if you wear too much compression, so too tight, too soon, it actually increases the risk of fibrosis. So you can't get right into that stage 2 tributo super tight faja, okay? It's actually gonna do you harm. That's why you have to start with your stage 1 faja. Stage 1 faja is a little bit more distensible. It's not as tight with the compression, okay, because we're protecting the skin. So that's, a lot of times our patients will say, "Hey, Dr. Earl, that stage 1 faja you gave me for the first week, it just feels very, very loose." And I'll say, yes, that is correct, and that's on purpose. You don't want to be, if you're too tight, initially, right after the trauma of surgery or the trauma of the liposuction, okay, you're not getting enough blood flow to that skin. And when you don't get blood flow, what happens? You get scar tissue, right? So, blood flow, good. No blood flow, scar tissue, bad, right?
No bueno.
No bueno. So you can't be too tight too soon, okay? But once you've gone over about those first 5-7 days or so and everything's looking okay, then you can switch to your stage 2 faja. And yes, your compression is going to help, and I do recommend wearing a faja 23 hours a day, basically night and day for the first 6 weeks, and then after that, you're gonna go down to 12 hours a day for an additional 6 weeks up until your 12-week or 3-month mark, okay? Once you get to 3 months, then it's a little bit more elective. A lot of patients can stop at that point with a faja altogether. Some patients decide to keep using it during the day, and that's okay, all right? So that's the second part there. And 3, this is a part that nobody really thinks about, right? Because it's not something that kind of immediately goes together. But for the very same reason we just talked about the blood flow, right? Hydration is incredibly important, okay? So, you know, the well that you're hydrated, the higher your blood pressure, right? The better the blood flow, okay? That means you're getting everything you need to heal the area, and there's less chances of scar tissue. Again, what is fibrosis? Fibrosis is basically stuff that is scarred down, inflammation and scar tissue. So we want to do things that decrease the risk of inflammation and scar tissue. All right, so hydration is incredibly important, and that's why we tell you to drink 1 gallon per day after surgery. We're going to drink 1 gallon a day after surgery. Now, let's do a little tiny quiz here, okay? How many ounces in a gallon? Anyone? Any guesses? How many ounces in a gallon, right? Because I say 1 gallon per day, and everyone's like, yeah, doc, 1 gallon per day. Got it. And then I'm like, okay, how much did you drink today? Doc, I had 8 glasses of water. I'm like, whoa. That's way below where you have to be, because a gallon equals 128 ounces. Okay? 128 ounces. All right?
Well, a lot of people guess.
Yeah?
Yeah.
All right, there you go.
128.
Excellent.
On TikTok.
Excellent. So people on TikTok, you guys are on top of it. There you go. So 120 ounces a day is what you have to drink. Mostly water, and then also something with electrolytes so that you don't lose all your electrolytes, your salt and chloride and all that stuff. So you got to drink something like Gatorade or Pedialyte, or you can buy some of those tabs, some of those electrolyte tabs to put in your water as well. Okay? So this is by far the most important thing you can do to prevent fibrosis. Okay? And if your surgeon leaves at least 1 centimeter of fat underneath your skin, is not overly aggressive, and you do your 20 massages, you don't overcompress too soon, and you hydrate, your chances of fibrosis are actually quite low. Okay? And what's that saying there? An ounce of prevention is, I don't know, the best thing you can do. That's not the saying, but okay? But that is the best thing that you can do. Okay? All right. But what happens if maybe you did all this and you still develop fibrosis, or you didn't do all this and you develop fibrosis? Okay, well then, what do you do now, doc, right? You know, I did it, or I forgot, whatever. The point is I have fibrosis now. Now what do I do? All right. Well, the treatment for that is going to depend on how far out you are from surgery. Okay, so if you're less than a year out, then we try to do things that are non-invasive or minimally invasive, okay? We try to work that scar tissue and that inflammation as best as we can. And so we do the non-invasive things. So the first thing that a lot of patients will do is they'll go back to their massage therapist, and the massage therapist is going to start what's called wood therapy. Wood therapy uses these wooden tools to try to break up scar tissue. And actually it works really well, but I'll tell you one thing, it's not comfortable. Okay? You're gonna have to take it, all right? But like I said, you know, this is a long-term investment. So, you know, when you have those treatments with the wood therapy, it can be a little bit painful sometimes, because the point of the tools is to try to break up and soften up that scar tissue. Okay? So yes, definitely it's not comfortable, but it's totally worth it. All right, you just gotta, you know, bear with it, grind it out. Okay, that's the wood therapy. Sometimes they can add other things such as cavitation, or sometimes carboxy treatments as well. Okay, cavitation is kind of more similar to this, as it kind of uses external ultrasound, which can be used. So that's what cavitation does. Carboxy therapy sometimes helps as well. That's when you inject carbon dioxide. When you inject carbon dioxide into areas of inflammation, it helps your body break up those areas of scar tissue and inflammation. Okay? So cavitation and carboxy therapy. which is like external ultrasound or sometimes external radio frequency. External radio frequency can help sometimes, with the inflammation and everything else, and sometimes it can actually help the skin as well, which is one of the advantages of radio frequency. Radio frequency can be done completely externally with a kind of like a wand type thing, like over the skin, or it can be done with microneedling, such as like the Morpheus 8, where it's a microneedle with RF energy combination that helps break up the scar tissue, soften things up, and helps with the skin retraction. Okay, so that's another possibility. And then if you have like a discrete area, right? You have like a very specific spot of fibrosis, then sometimes we can actually treat that specific spot with either steroids or something that's called 5-FU, 5-fluorouracil, which can help basically break up the scar tissue and the inflammation in that specific area. Okay? And this is an injection. There's going to be an injection that's placed into that specific spot. Sometimes it can be a little bit painful, yes, but again, you got to bear with it to try to soften up that area. Okay? The other option, you don't see it so much here in the US, but although you can get it, but you see it a lot in Colombia, is they have specific enzymes. There's an enzyme that you can inject into the area which will quite literally break down that scar tissue. Okay? And we can do that as well. Okay? So these are the treatments that you have to undergo if the fibrosis is somewhat soon, like less than a year. Once you're over a year from surgery, then a lot of these like less invasive things are not gonna work as well. All right, because then it's kind of really like socked in. Now it's really become like basically pretty tough scar tissue. It's the wood therapy is not gonna break it down. None of these things are gonna break it down. Maybe the enzymes could potentially break some of it down, but it's not gonna be as effective. Okay, so at that point in time, we're looking back to surgery. We got to go back. So what are we going to do when we go back? Well, we got to actually physically break up the area with our cannula. Okay, and what really helps with that is the use of the vaser. All right, so the vaser, you guys have heard me talk about that, but it's what it is it's also a wand that we put in through the same incision that we use the liposuction cannulas, and it uses ultrasound energy. All right, not imaging, energy. It uses ultrasound energy to break up these areas of fibrosis. So you'll go in, first you put in your tumescent fluid, which is what helps decrease blood loss and whatnot. And then the next step is your vaser. Okay, the vaser helps release the fat, break up the areas of fibrosis, and then the third step is to then do some liposuction, liposhifting to smooth everything out. Okay. So that's what's required after a year, is to go back and use the vaser plus liposuction to remove or break up the areas of fibrosis and smooth things out. Okay? All right. So I think that kind of breaks it all down. But I tell you, really, this is by far the most important thing here, because you don't really want to be getting into this. Okay? Other risk factors for fibrosis, so I forgot to mention, is what people call smart lipo or laser, not with an L. Laser, not V, not laser with a V. Different. Laser with an L. So smart lipo or laser lipo, that because of the high energy that uses, it does increase the risk of fibrosis and scar tissue. So you have to be very careful with that. Actually, I don't really recommend smart lipo or laser lipo. I don't think it works well. I think the risk of scar tissue or skin dying, skin necrosis, lipo burns is too high. I don't do that here, and I don't recommend it. Okay? And then if you do develop all these things after laser, okay? So I don't recommend that. All right? Okay. Let's hit it.
Okay, for me, this is an urgent question. I didn't get massages after my tummy tuck. Okay. Is that bad? I'm 2 weeks post-op.
All right, so the good news is that you're 2 weeks post-op, so you're well within the time period where we can do something about it. But yes, I would have recommended you start with your massages as soon as the next day. Okay, But you're 2 weeks out, which is good news, so you should start now. For tummy tuck, I do recommend a minimum of 10 massages, so it's a little bit different than the 20 that you need for liposculpture or BBL. But because the areas are more focused, at least typically when I do a tummy tuck, I do lipo only to the flanks and the waist area. It's a little bit more focused there, so I recommend 10 massages, and you should start right now.
How long do I need someone to take care of me after a tummy tuck?
So, certainly you have to have an adult with you for the first 48 hours at all times, 24/7, right? For the first couple of days for sure. And then after that, remember, you're not going to be able to do any heavy lifting or strenuous activity for the first 6 weeks. So it depends on basically how, what's your situation at home, right? Maybe you have, kids and stuff like that. You got to, think about that. But you won't be able to lift any much more than 10 or 15 pounds for the first 6 weeks. Okay? And then in terms of driving, typically after a tummy tuck, you're not really back to driving to at least somewhere between 3 to 4 weeks out. So you have to think about that as well.
Can I do Avali for cellulite without any other surgery, and how long is the recovery?
Yeah, of course. So we can do definitely the Avali for the cellulite. And if you're doing it just on its own, the great news about that is that you can do it right in the clinic setting. It's basically an office procedure where you come in and come out. You can drive yourself. You don't need anyone with you. It's all done under local anesthetic. Okay, so you can certainly take care of that, and it takes potentially like an hour or so. Okay, so that's definitely something that you can do. Our nurse practitioner Danny, she's actually like our peer expert with the Avali here in the clinic, and she'll take great care of you. Okay. What was the other part of the question in terms of recovery? Really, it's like I said, you can go back to regular life right away. You may see some soreness, see some bruising. We do recommend a little bit of compression with like wearing like something like Spanx or tight kind of like booty shorts. Okay, just to give a little bit of compression. But other than that, you could just go about your normal life.
Can you still get great results on a square or invert triangle body shape?
You can. We can definitely change the shape, right? This is a lot about what the liposculpture is about. And of course, there are going to be some foundations that are going to be more challenging than others. And there may be some foundations where you need more than one round to really achieve the result that you want, okay? But going from square, basically SpongeBob to Jessica Rabbit, that's what we do here all day in, day out, okay? And that's why the BBL or liposculpture or fat transfer is such a powerful surgery, because honestly, that's really the only way to do that. Working out, doing exercise, it's not really going to change your shape that much. It might make you go from a bigger SpongeBob to a smaller SpongeBob, but the overall square shape is going to remain. So the way to really change that shape is with a liposculpture and BBL. Basically removing fat from the areas you don't want and adding fat to the areas that you do want, okay? Now, the inverted triangle shape in a woman who we then want to turn that into an hourglass shape, that's definitely more challenging. And sometimes those patients require more than one round. So remember, no two patients are exactly alike, right? There's many factors that are contributed to how much we can do in one round. For example, how much fat is available, how much fat is going to survive, what about the skin? Is the skin distensible? How far does it stretch, or does it become really tight too soon? So all these factors come into play, which will determine just how much we can do in that first round.
Why it's less risky to do a mommy makeover than a tummy tuck and a BBL? And thank you for your time.
Okay, so I think the question is, what's less risky, doing your mommy makeover versus combining the BBL and the tummy tuck, right? And I agree with you. So I think doing a mommy makeover where you're combining a breast surgery with your tummy tuck surgery is less risky than combining a basically lipo 360 BBL and tummy tuck at the same time, okay? The mommy makeover is a combination that we do very often, day in, day out, right? And the breast can be a breast augmentation, a breast lift, breast reduction, any breast surgery that we combine with a tummy tuck. Everything is being done in the front, right? We're not turning patients around, we're not flipping them over or anything like that. Also, the liposuction is very contained. We're doing liposuction to the flanks and the waist, and we're only removing 1 liter of fat via liposuction when we do that combination. And so most of it is under direct vision, so blood loss is very, very minimal, okay? And, of course, we always prevent for blood clots or DVTs. But the patient can recover in a kind of recliner type position, okay? And that way you protect both your tummy tuck and your breast surgery. Now, when you do if you try to combine a tummy tuck with a BBL, now we're talking about opposite things that you have to protect. You gotta protect the tummy in the front, and then you gotta protect the booty, right, and the hips in the back. So now we have a problem. How do you protect both things, right? Well, we can't just hang you from the roof, right, for 6 weeks. So what ends up happening is you compromise one thing or the other. Well, you certainly can't be in your belly, because that's where you have your big incision, and that's where we did the muscle repair and everything else. So you are gonna have to be on your back, and then, so what's the next best thing? Well, you're gonna create a cutout, you're gonna cut out the mattress, you're gonna get a cutout in the chair, blah, blah, blah. But the point is that you're going to be compromising your BBL result, okay? That's the other thing. The other thing is blood loss. There's a lot more blood loss when you do that surgery because you're doing a lipo 360, okay, with the tummy tuck. So now your blood loss is higher. The risk of needing a blood transfusion is significantly higher as well, okay? Then, because you can't really move around, the risk of blood clots is higher too. So yes, overall, all those risks are higher when you make that combination, which is why I don't do it. I don't combine a lipo 360 and a tummy tuck procedure. I always recommend doing your tummy tuck first.
Okay. When do you suggest a panniculectomy versus a tummy tuck?
So a panniculectomy is typically preserved for like a massive weight loss patient who's having issues because they have overhanging skin. And typically the most common issues that they have rashes and fungus underneath that skin. And what a panniculectomy, what does that mean? It means all you're doing, you're simply removing excess skin. You're not doing anything else. You're not doing any shaping, you're not doing any muscle repair, and nothing else. And that's why panniculectomies sometimes are covered by insurance. But it's not really an ideal surgery. All you do is cut off excess skin, and you don't do anything else. And so for those patients that are having those issues, they may be happier because they don't have those issues, but you're not creating that beautiful shape. All right, if you want all of the above, then you go for your full-on tummy tuck, where you are removing the excess skin, you are doing the muscle repair, you are doing liposuction to the flanks and the waist, you're bringing out that curvier, more beautiful shape, and putting all that together.
Can you get a BBL on a loose butt skin?
You can, as long as it's not too loose, okay? So yeah, we've had actually weight loss patients, many weight loss patients, or sometimes after pregnancy, where the skin in the buttock area, does become a bit more loose because there's a loss of volume to the area. If you have anywhere between, I would say, mild to moderate loose skin or skin laxity in the buttock area, I think just filling it with basically fat, filling it with volume is enough, and you don't require a skin resection type of surgery, okay? Now, if you have been like a massive weight loss patient, and you lost whatever, 60, 80, 100, over 100 pounds, and the skin in the buttock area becomes anywhere from more, higher, moderate to severe loose skin in the area, well, in those patients, then yes, the recommendation would be what's called a surgical buttock lift, where you're actually removing all that excess skin. But that does mean that you're going to have an incision, a scar in the back, typically in the shape of kind of the upper buttock. We call it kind of like that seagull shape there, because all that excess skin needs to be removed. A lot of times you can combine that surgery with some fat transfer, so that surgery removes the excess skin, and the fat transfer allows you to fill more volume, especially in the lower half of the buttock, to create a nicer shape overall. Mm-hmm.
Well, the last one is post-surgery. After how long can you resume birth control? So how long
Yeah.
after surgery can you resume birth control?
All right, so that's a great question. So anything that has estrogen, okay, can increase your risk of blood clots. So that's why we ask you to stop all your estrogens 30 days from 30 days before surgery to 30 days after surgery. Okay? And that is estrogen in any form. So the most common is the oral contraceptive, the pill, right? But if you have estrogens in some other form, whether it's a implant, injection, whatever, or a cream, again, you got to stop that too. So anything that has estrogen, you're going to stop from 30 days before surgery to 30 days after surgery. Okay? Now this is different from progesterone. If we have something that's strictly progesterone, so no estrogen, just progesterone, like certain IUDs and other implantable devices and things of that nature, then that's okay. You don't have to stop those. So as long as it's just pure progesterone, it's okay. But anything that has estrogen, you gotta stop. Okay? All right, everybody. Well, it's been great to be back. I missed you guys. Hope you missed me too. And well, I look forward to catching all of you next week on Hump Day with Dr. Alex Earl. We'll see you then. Ciao.